welcome to the TEDxSF stage, Sam Hamner.
Today, there are 10 million above-knee or thigh-level amputees living in developing countries around the world. But only 5% of amputees are ever fit with prosthetics, leaving 9.5 million above-knee amputees without a prosthetic knee and the mobility that it can provide. Many amputees in developing countries, like these 3 patients my team visited at the Jaipur clinic in India, rely on improvised and homemade solutions to get around. This causes a drastic reduction in mobility, which can lead to unemployment and severe social stigma. State-of-the-art solutions in the United States and Europe rely on sophisticated microcontrollers, motors, and sensors to help patients regain mobility. But at costs of up to $20,000 per prosthetic, they're just too expensive to be affordable, to be accessible. Not to mention, these devices require costly regular maintenance and are not robust enough for rugged terrain or wet environments. On the other side of the spectrum, there are low-cost solutions in developing countries, like this knee developed by the Red Cross. But typically, these low-cost solutions rely on what's called a single-axis joint. And you can think of a single axis as having the same simple motion as a door hinge. And unfortunately, this single-axis design is notoriously unstable. In this video, our patient Ash is walking around on a single-axis knee. And you can see it's extremely difficult for him to take a step with confidence because he has a fear of falling and he cannot trust his prosthetic. At D-Rev, based here in San Francisco, we've developed a radically affordable prosthetic we call the ReMotion Knee. Based on a 4-bar linkage design, our knee provides superior stability while allowing patients to have a much more natural walking motion. Now, this mechanism has actually been around for about 40 years, but we're making it out of high-strength plastics and using centralized manufacturing so that it's both durable and affordable at a cost of about $80 US. Now, the team at D-Rev has created a device that lets people walk again, but for us, mobility means more than just walking. Now, I consider myself a bit of an avid cyclist. I'm fortunate enough to be able to ride my bike to work. I love going on long rides on the weekend across the Golden Gate Bridge. But for many amputees, riding a bike remains challenging because most prosthetics have a limited range of motion. That's why it was all the more compelling when we saw Sonu Kumar, who was fit with a ReMotion Knee. He was able to hop on a bike and start riding around again. I was amazed by how such a simple device, when designed the right way and delivered to someone who really needed it, could be extremely effective. At D-Rev, we believe we can generate a spark and create a revolution in design where we create world-class medical technology and innovative healthcare solutions that are affordable and create a measurable, significant impact on global health. And in the coming months, we're launching a campaign to fit up to 1,000 more amputees with the ReMotion Knee in our efforts to remobilize those 9.5 million in need. Thank you.